Awesome. So I'm Dr. Rita Mcguire. I'm the Chief Medical Officer here at Wakana, one of the co-founders. I represent the pillar of health. I want to just welcome all of our business partners and all of our guests. I know you guys are trying to figure out what was I going to talk about. Guess what? Dr. Rita was trying to figure out what she was going to talk about as well. So I reached out to one of our business partners, one of our sapphires, T-Mac, who's in my team, and asked her, well, what do you want to hear about? Because no one emailed me. Guys, you got to email me and let me know what you want to hear. So she said, I want to hear about cholesterol and CBD. So we're going to talk about cholesterol. But first, I promised you guys that every Wednesday I would dedicate, because it is Black History Month, I was going to dedicate our webinar to an African American female physician. So this evening, we're going to dedicate this webinar to Helen Octavia Dickens. See, Helen Octavia Dickens was an American physician, medical and social activist, health equity advocate, researcher, health administrator, and health educator. She was the very first African American woman to be admitted to the American College of Surgeons in 1948. And guess what she specialized in? You guessed it, OB-GYN, just like me. So I am just so inspired by her story. Every Wednesday, I want you to go and dig deeper and really look at the history that is so rich in the medical field as it relates to African American physicians. So Helen Octavia Dickens is our spotlight hero this evening. So a little bit about me. I am a mom of 3 adult amazing children. I have a 30-year-old, that's Jacob. I have a 25-year-old, that's Joshua, and the baby girl, Hannah, who's 23. So they truly are my why. They are my legacy. That's what really excites me to really build my business with Wakana. So that's a little bit about my adult children. Only one is still on my payroll, that baby girl. Got to get her through medical school, but once that's done, I will be free and clear. So yes, I'm still a practicing physician, an obstetrician gynecologist, as was Helen Octavia Dickens, still performing C-sections and hysterectomies. And I'm telling you guys, we are seeing a boom in COVID babies. Yes, lots and lots of babies are being born due to our sheltering in. I've transitioned my gynae practice a little to cosmetic surgery. So on the right, you'll see I'm performing a liposuction. On the left, I'm performing a hysterectomy. So that is what I've been doing for the last 30 years. But 4 years ago, the CEO of this company, Melissa Boston, introduced me to CBD. She inboxed me through my Facebook. We were Facebook friends. Never met personally, but we followed each other for years. And she inboxed me and she said, do you know about CBD? And I absolutely knew nothing about CBD. I had never heard of CBD. But what I did 4 years ago, I did my due diligence. I studied this compound that comes from the cannabis plant that I had never heard of. And when I found the information that it is an opportunity for my patients to assist in so many of the challenges that many of our patients face in a holistic way, in a natural way. But what was really exciting was that it was a way that they didn't get high. They didn't have the euphoria, the paranoia, or the high that marijuana would give our patients. So I was excited. I've been on board ever since. And truly, I'm an advocate for this plant. In fact, I testified in front of the Judiciary Committee for the legalization and taxation of adult use cannabis laws here in Illinois. So Illinois was the 11th state to accept cannabis laws. So I'm truly, truly like the coolest mom ever. My kids think I'm really cool now because I'm not that mom anymore saying, "What are you doing? What are you doing?" All three of them love our products. All three of them use our products. And in fact, the baby girl is in the business. So let's talk about cholesterol, right? You may know someone or you may have high cholesterol. Um, High cholesterol can limit blood flow. Now, if you joined me last Wednesday, we talked about our love is in the air products, right? We talked about erectile dysfunction. We talked about a lot of sexual dysfunctions that are a result of blood flow, right? So, are you seeing the theme, that constant theme that we always see when we look at chronic conditions? It's either a blood flow problem or an inflammation and blood flow. So cholesterol can limit blood flow in our blood vessels, which can cause and increase our risk of heart attack, increase our risk of stroke. Cholesterol is detected by a blood test. High cholesterol typically has no symptoms, and treatments we know include medications. You can see the gentleman here. He's eating a salad, and on the right is a bottle of his medication, his statins. And it is truly a challenge that many millions of people face in America is high cholesterol. So treatments include medications, healthy diet, and exercise. So let's talk about cholesterol because not all cholesterol is bad. There is good cholesterol, and the good cholesterol is called HDL. The bad cholesterol is called LDL. So you can imagine that you're going to want to have higher levels of HDL in your blood and lower levels of LDL in your blood. So on the very far left, you'll see a blood vessel that has a low amount of plaque or buildup of cholesterol. The middle one has a normal amount, and then the right has a very high amount. So that is when we have a blood vessel that you can anticipate would have very, very little flow because it is filled and packed with that bad cholesterol. So let's look at what a good cholesterol is. So you go to your doctor, you're doing your physical exam, and your doctor says that your cholesterol level is 180, total cholesterol level, and your LDLs are 90. And so when you look at that chart here, that's good. We want your total cholesterol to be less than 200, but the lower the better, right? I have so many friends who are like, my cholesterol was 199. And I'm like, well, that's good, but we would really like it to be lower, not so close to the 200 mark. Now, the LDLs, remember, are the bad cholesterol. So we want that bad cholesterol to really be less than 100, but below 70 if you have coronary artery disease. And, unfortunately, my mother passed away when she was 72 years old because she had coronary artery disease. She had high cholesterol, and unfortunately, she was obese, continued to eat poorly, and developed coronary artery disease, had a triple bypass, and did not survive that surgery. So it's really something that you have to be very, very diligent in ensuring that when you have your annual exams, you know your numbers. You know your hemoglobin A1C. You know your total cholesterol. Now, borderline to moderately elevated are levels of a total cholesterol between 200 and 239. And that bad cholesterol, LDL, is 130 to 159. That's a borderline to moderately elevated. Now, high cholesterol is 240 or higher with the LDL of 160 or higher. An LDL greater than 190 is considered very high, very dangerous, and again, increases you for risk of heart attack and stroke. So let's look at some of the food that contains cholesterol. So we can absorb cholesterol from foods like meat and dairy and other animal foods. And also the body produces cholesterol in the liver. So there can be, so many avenues of an elevated cholesterol level, not only from your diet, but from the processing of cholesterol from your liver. So when we look at a normal blood vessel, the very top is what a normal blood vessel should look like. It's a vessel where the blood flow, there's that word again, blood flow is easily transmitted through. Now the second diagram shows where the blood flow is a little occluded. We can see that there's plaque filling up in the blood vessels, and the blood flow is a little compromised. And then, of course, the third diagram shows complete occlusion, compromised blood vessel, and this plaque buildup can cause a stroke or heart attack. So what are some of the tips for managing your cholesterol? Many folks that have high cholesterol typically have diabetes, or those with diabetes have cholesterol. They typically have high blood pressure. Many times they have kidney, renal conditions as well. We want you to eat more fiber. We want you to eat fat, but the good fats, the olive oils, the avocados. Exercise. I can't stress that enough. I've been busy all day at the hospital. I ran to do my workout and I'm back at work. Whatever you can do, however you can fit it in, get at least 30 to 45 minutes of exercise every single day. And then quit smoking. If you're a smoker, stop. We've got some products that we're going to talk about to help you stop smoking. So eating a balanced diet, more of a plant-based diet, eliminating dairy, eliminating red meat, having fresh vegetables. These are the things that you want to do. You want to avoid these foods: margarine, microwave popcorn, which I love, butter, macaroni cheese, which we all love pretty much on this line, right? Hamburgers, fried chicken, got to stay away from Harold's, French fries, shellfish. A lot of people say, Dr. Rita, can I eat shrimp? I'm trying to lose weight. Shellfish like shrimp and crab legs and lobster, those are scavenger fish. Those are the fish that eat the crap from the bottom of the sea, and they're high in cholesterol. They're fatty fish. They're fatty foods. So you want to stay away from shellfish as well. What do we use for treatment and medicine? Statins. Pretty much Lipitor is the #1 drug that we use and we give to our patients who have high cholesterol. And statins have been shown to be a gateway drug. That means that this drug, statin, causes more side effects than the law allows. It causes issues with body myalgia, dementia, early dementia, elevated blood glucose levels. It causes abnormal liver function. So when you're on this drug, your doctor is going to be monitoring your liver function. So many times when a patient is started on this medication, a statin, to lower your cholesterol, they end up on 6 or 7 different other medications because of the side effect from this one medication. So, this is what we have to offer. But could CBD be an option? Could CBD help lower cholesterol? And that's what we're going to talk about tonight. We can't make any claims. We can't make any claims that CBD would cure, mitigate. We can't make any diagnosis. But what we're going to talk about now is some studies or some research or some data on what we know about CBD and how it works in the body. Well, Dr. Sanjay Gupta, we all know of Dr. Sanjay Gupta, really has made cannabis mainstream. And in 2013, 2014, he came out and made a public apology. He said, you know what? We didn't really dig deep enough and really look at the data on cannabis and how it can help patients. We were systematically misled, he said, about this plant. He traveled the world and just met thousands and thousands of patients that actually received many medicinal benefits from cannabis. So when we look at cannabis, when we look at the family of cannabis, it has two species. One species is the marijuana species, and we may all know about marijuana, right? That's the species that gives you the high, the euphoria, the paranoia, the munchies. It has a high level of THC, or delta-9 tetrahydrocannabinol, long word, but THC, and it has very small amounts of CBD. But then there's hemp. It's the other species of the cannabis plant. And this is what sold me. When I found out that CBD coming from hemp can give our patients the same medicinal benefits that marijuana does, but without the high, I was on board. I was like, wow, this is crazy that they didn't teach us this in medical school. I had no idea that there was a compound called CBD, cannabidiol, that could help with so many conditions. So it's CBD that comes from hemp that contains very low amounts of THC, 0.3% or less, that really helps to give our patients a chance, you a chance, your family members a chance when we're looking at those who have high cholesterol. So again, CBD stands for cannabidiol. It's the second most common cannabinoid or compound found in different strains of the cannabis plant, but it's the most common compound found in the hemp plant. Now there's other compounds. There's over 100 plus what we call cannabinoids that the plant makes. But these are the main ones right here: CBD, THC, THCA, CBG, CBN, CBC, THCV, and CBDA. These are the main cannabinoids that the plant makes that we're going to be talking about that are found in our products here at Wakana. So this may be blurry, so I'm sorry, so sorry. But this is what we call our cannabinoid wheel. And this wheel, again, shows the main cannabinoids that we talked about. But as you can see in this diagram, you may not be able to read all the words, but it's CBD that is the main player. CBD, cannabidiol, is the one that has the most medicinal benefits out of all the other cannabinoids. CBD helps with being antibacterial. It helps to inhibit cancer cell growth. It's a neuroprotection or protective for those who've had strokes, Parkinson's, neuropathy, any nerve damage. CBD has been found to be neuroprotective. It helps to promote bone growth. It reduces seizures and convulsions. It reduces blood sugar levels. It reduces the function of the immune system, which means it helps to quiet the immune system in those who have autoimmune diseases like fibromyalgia and lupus and multiple sclerosis. It helps to reduce inflammation, right? Inflammation, blood flow. Remember those two words. It also helps to reduce arterial blockage. Wow, we just talked about that. We talked about how high cholesterol can cause a buildup of blockage in the arteries of our blood vessels. It also helps to reduce nausea and vomiting. So a lot of people who are undergoing chemotherapy for cancer treatment, it helps to reduce nausea and vomiting. It helps to relieve anxiety. How many of us are under a lot of stress and anxiety with everything that's going on in the world, right? We're even anxious about the treatment that is now being offered for COVID, let alone the global pandemic. It helps to slow bacterial growth. It helps to suppress muscle spasms. We talked about multiple sclerosis. It helps with the muscle spasm. It also treats psoriasis, eczema, acne, a lot of the skin disorders. And CBD is a vasorelaxant, blood flow. Again, CBD helps to open up blood flow or open up blood vessels in order for blood flow to be appropriate. So it relaxes the blood vessels, it opens it up. So when we talk about erectile dysfunction, when we talk about coronary artery disease, when we talk about high cholesterol, we talk about hypertension, blood flow, reduction in inflammation, and being a vasorelaxant. These are the key benefits that CBD offers. Again, we cannot make claims and say CBD treats high cholesterol. We just can't do it. The FDA does not allow us to do that. But what we can say is that, oh, we know over 20,000 peer-reviewed articles, do your due diligence, shows that CBD is a vasorelaxant. It also shows that CBD is an anti-inflammatory. It also shows that CBD reduces arterial blockage. These are things you can say, right? Now let's look at the other cannabinoids. CBG, CBC, Delta 8 THC, Delta 9 THC. All of these other cannabinoids are important to be around, to have that synergy on a cellular level to really cause a reduction in inflammation, a reduction in pain, a reduction in anxiety. So CBD, along with all of its cousins, are needed. So let's look at the science. How does CBD work? And that's really important because when you look at that long list of medicinal benefits that we just talked about, it almost sounds like a snake oil, right? It almost sounds like a magical potion that is in the ground, but there's science behind how CBD and THC and the other cannabinoids work. And the science is called the human endocannabinoid system. This system was discovered in the early 90s when I was at Wayne State School of Medicine in Detroit. No, we did not learn about the human endocannabinoid system. In fact, less than 5% of medical schools are teaching about the human endocannabinoid system, despite the fact it is the most vital regulatory system in our body. It regulates our blood pressure, regulates our pulse, it regulates our mood, our sleep, our wake cycles. It keeps our body in homeostasis. It keeps our body in balance. And the way it does that are through receptors. See, there are receptors throughout our entire body. You can see the picture here. Every organ and gland has receptors that are looking for cannabinoids to bind to receptors to reduce inflammation, to reduce arterial blockage, to vasorelax the blood vessels so the blood flow will improve, among many other things that CBD and THC and the other cannabinoids do. So this is the science. This is how CBD and the other cannabinoids work in our body through receptors that bind and send a signal to different areas of the body, to the brain, to the central nervous system, to the immune system, to the periphery, to the lungs, the liver, the skin, the teeth, the heart, the bowel. All of these organs, major organs, are looking for cannabinoids to put the body back in balance, right? So these are another list of medical issues and some disorders that uh, CBD can medicinally work on the body. It's a long list, and you can again search your favorite, use your favorite search engine, and just do more research, do more studies on your own. So let's get into our products. Our products here at Wakana are amazing. First, a disclaimer. This disclaimer reads that these products should not be used or sold by persons under the age of 18. Our vape cartridges are not for use or sales to persons under the age of 21. If you're under a doctor's care, if you're on medicine, if you're nursing, if you're pregnant, please consult your physician. Again, these statements have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or prevent any disease. Really important to know that when you are under a doctor's care, this is the opportune time to let your physician know that you want to start using CBD. You've heard about these studies. You've looked up some of these studies. At the end, I will share my email, share some studies with your physician so that you can incorporate CBD with your traditional medications to help to address conditions that you may be facing. So our product line is amazing. We have products that address so many different challenges. We have a hair care line. We have a sanitation line. We have tinctures and topicals and edibles. We have products for sexual dysfunction. It's just an amazing product line. We can't talk about every product tonight, but we will group them in categories. All of our products are fully tested. We have a certificate of analysis on every single product. It's a full page panel testing to ensure that our products are free from mold, mildew, heavy metals, pesticides, residual solvents, and toxins. These certificates of analysis will show you the amount of THC, which is always 0.3% or less. Will also give you an indication of the milligrams of CBD in the bottle, the percentages of the other cannabinoids that we talked about tonight. And this is critical. I mean, this is critical to have a product that's tested, third-party validated tested, so that you understand that what we say on the label is really in the bottle. So number one, hands down, for those who are looking for overall wellness, maybe you're on the line and you know someone that has high cholesterol or diabetes or hypertension or arthritis or fibromyalgia or migraine headaches or erectile dysfunction or sexual dysfunction, whatever it is, the Wakana Wellness Essential Pack is the way to go. This is a package that has products that address inflammation that we talked about, products that address vasal relaxing of the blood vessels that we talked about, reducing coronary or blockage of the arteries. It addresses relieving anxiety and pain. These products also address obesity or weight management or weight loss. So all of those products in this one package is essential for our wellness. Again, this is a package that includes our Fat Belly coffee, which includes, of course, CBD in a very great way to start to reduce the inflammation, not only in the body, but in the abdominal area. Whenever you have abdominal girth, that is a big belly. That is putting a lot of pressure on your heart. Your heart has to work harder when you have a lot of fat around major organs. It also includes our gummies. You know, our gummies are another way of consuming CBD in a way that can be used during the day or the night. This package includes, and we're going to talk about in detail, our topical product. Topical CBD products are great for offering local relief for pain and inflammation. It also includes our tincture. Those are products you use underneath your tongue, as well as our smokable. Smokable products are really, really important when you're dealing with acute issues. You want to address something within 1 to 5 minutes. And then our new carb curbing bitter tea. So all of these products have a role in reducing inflammation, in causing blood flow to be improved in major organs, as well as a vasal relaxing and anxiety reducing products. So let's look at our tinctures. Again, our tinctures are products that you place underneath the tongue twice a day. Now, our product line combines two lines. It's our Pure and our Power. Let's talk about our Pure first. Our Pure are in the white label bottles. The white label bottles are our broad spectrum products that contain less than 0.0% of THC. Our Pure products are great products for those who want to use CBD, but they have random drug screens at work, or they've been prohibited at their job from using any products that may show up in their urine. The Pure tincture is what you want to use. And when you're dealing with chronic conditions, long-term conditions, like high cholesterol, for example, you want to make sure that you're utilizing all of the different methods of consuming CBD. So one way of consuming CBD is through our tinctures. 3 drops in the morning, 3 drops in the evening is a great way to start all of our tinctures. We also have a water-soluble product. That's a product right in the middle. It's a power product. Our power products mean they have the legal limit of THC, 0.3% or less. So our water-soluble product is a product you can put in your beverage, your water, your juice, your oatmeal, your food. It's very, very convenient for those that may be dealing with dementia or a cognitive condition where they don't understand to hold an oil underneath their tongue for 60 seconds before they swallow. So that is a great product for that sort of population. So our tinctures and our power line, the potency is as high as 750 milligrams, going down to 500 milligrams in our power line, and our pure line is 300 milligrams of CBD. That's in that entire bottle. But again, 3 drops in the morning, 3 drops in the evening. We also have a tincture that you can bake with, you can cook with. Yeah, you can. We don't want you eating cookies or baking brownies, especially if you're dealing with high cholesterol. But anything that you're cooking and baking, you can use what we call our Culinary Plus. That is another great product that can be used as a tincture, or you can bake and cook with it. Our topicals offer local relief. Many folks who have chronic conditions, high cholesterol, may also have arthritis, chronic pain. Our topicals come in so many different varieties, from an salve sort of cream to a liquid. Our salves are 200, 400, and 500 milligrams of CBD, and it really depends on your severity level. It depends on the severity level of your condition as to which product may work best for you. I say you purchase all of them and see what works best for you. I use all 3 of the topicals. I use the 400 or the 200 milligram Power Relief at night. I use the Dr. Rita's Rub, the one on the far right. It's a liquid topical. I use that pre-workout, and then I use the 500 milligrams post-workout. So I have a little regimen that I use that gives me relief to that sore knee, sore back. And guess what, guys? That heel spur that I was dealing with, totally gone, right? Amazing products that has helped with my heel spur. Our topical Power Mango Body Cream is a great product for those who are dealing with conditions of the skin. It adds moisture, it helps build the collagen, and CBD, we talked about, not only reduces inflammation, but reduces bacterial growth. So, a lot of those skin conditions like psoriasis and acne, and even eczema, either deal with the inflammatory process or a bacterial process. We also have our oud body oil, which is an amazing way of conditioning and moisturizing the skin. That one does not contain CBD, but we also have a hemp powered hair. It's another topical product because it's a product that can be used topically in the areas of hair thinning, hair loss, etc., for those who want to use a power product and uh, not be limited because of drug screen. So topical products, though they're power, though they contain the legal limit of THC, can still be used in those who have random drug screens. Why? Because topical products do not pass the blood-brain barrier. They do not pass in the urine and can be safely taken by those who have urine drug screens. So all of those topical products can be used in those who have random drug screens. Let's look at our smokables. Our smokable products are all power products. So if you have random drug screens, you cannot use any of these cartridges, our pre-roll, or our premium flower. Smokables are great products for those who smoke nicotine. This will cut the craving for nicotine. So if you have a loved one that smokes and you want to stop them, you want to purchase this product for them. Always ask if they have random drug screens first before you share these products with them. The cartridges, again, use organic CBD, and all of our products are organic. None of our cartridges have deadly fillers like the cartridges that really harmed and even killed several people last year. They found that those cartridges had vitamin E. Vitamin E, when heated, becomes toxic to the lung. They also found that those cartridges had fentanyl and rat poison and very, very harmful, deadly chemicals. Our products don't contain any of those deadly chemicals, harmful chemicals at all. So, smokable products work within 1 to 5 minutes. That's what I love about them. If you have an acute onset of anything that you want to address within 1 to 5 minutes, it is the smokable you want to use. Our spices, our butter is vegan, non-GMO. It is a great, great product that you want to consume. You don't want to be like my daughter who thought it was a body butter and put it all over her body. And when I went to get my butter out of the refrigerator, there was very little left. This is not a body butter. This is a butter that you put on your toast. You put on your, what am I going to tell you that's healthy? We don't want you out there eating a lot of pancakes, but you know what I mean. You're going to use this butter, vegan, non-GMO, great, great, 300 milligrams of CBD. Our spices are very unique. Our spices are not coated, they're infused with the CBD. So you can even use our chili lime, our garlic fire, our flavor king as you are cooking. Essential oils are very, very well researched as it relates to reducing cholesterol, helping with blood pressure, helping with inflammatory conditions like arthritis. So our essential oils, black seed, hands down, is something you want to add with these CBD products if you are dealing with diabetes, if you're dealing with cholesterol, if you're dealing with hypertension. You know, research has shown that black seed rebuilds the beta cells of the pancreas. They rebuild the cells that produce insulin. Now, in your type 1 and type 2 diabetics, these cells are low functioning. They can't produce insulin like someone who is not diabetic. So black seed really helps to reduce the inflammation, helps to rebuild those beta cells and helps those who are diabetic. Eucalyptus, peppermint, tea tree. We even have lemon now and frankincense and myrrh. Those are essential oils that you want to incorporate as well in your wellness pack. And then we cannot forget our love is in the air. You know, we talked about last week erectile dysfunction, a reduction of blood flow to the penis, right? You improve the blood flow, you reduce the inflammation, you address the diabetes, you address the cholesterol, you address the hypertension, and you have an improved sexual life. So these are products that will help, along with that wellness pack, these products will help to um, bring spice in the bedroom, to address some of those issues that we talked about, to improve blood flow and to improve libido, to improve vaginal lubrication, etc. We also have a trio, which is our oud body oil, along with our gummies and our topical. That is a special going on, as well as the special of our Valentine pack as well. These are products that you absolutely want to purchase tonight so that you will have that for Valentine's, along with the wellness packages, the tinctures, the topicals, the smokables, etc. So here is my email, ritamd@wakana.com. Please screenshot that, write that down. You can send me questions. You can send me some suggestions. Maybe you're looking for some articles that you want to take in to your next doctor visit, or maybe you're doing telemedicine. You want to share this with your health care professional, and you just want to just equip yourself with as much knowledge about CBD as you can so you can feel confident when you're speaking to your family, to your friends, and you're sharing these amazing products. So I'm going to open it up for questions right now. I'm going to see if there's any in the chat first. If you don't have a question in the chat, please feel free to put a question in the chat. We do have two of our medical advisory board members that are on, Dr. Rashonda Conte and Dr. Tyus Crawford. They are on as well. Dr. Crawford is a family physician. Dr. Rashonda Conte is a clinical psychologist. So we are here for your questions. Wow, these are a lot great testimonies. My mom is now 1 year cigarette free due to me introducing her to the pre-rolls and the vapes. Thank you, Keisha, for that amazing testimony. Yeah, I have about 3 people that have reduced their cigarette intake tremendously by using our CBD pre-roll. Will there be a flat belly tea coming? Yes, there will be a flat belly tea coming very soon. Which products do you use for hypertension? Use all the products we talked about for hypertension. Which products will help with eczema? All of our products, you know, when you're dealing with eczema, any psoriasis, you want to make sure that you have the tincture on board. You want to make sure that you have the gummies on board. You want to make sure that you have that Power Body Mango Cream on board. So when you're dealing with a lot of these chronic long-term challenges, you don't want to just use one product, not just 2 products, but you want to try to use all of our products so that CBD is in a steady state in your system. So you've got CBD with the gummies while you're sleeping. I like to take a gummy at night. You've got the tinctures on board, 3 drops twice a day during the day. And if you need gummy or 2 in the afternoon, depending on if you're using the power or the pure. I typically like using the gummy with the less than 0.0% or less of THC during the day. And I like using the power gummy with the 0.3% or less of THC at night. It helps me sleep. Shingles and CBD. So you want to hear about shingles and CBD? Wonderful. Dr. Conti, you have a guest. Tasha Brown is on. Can we help with blood clots in the legs? So blood clots in the legs, which are DVTs, is something that you want to take care of medically, right? A blood clot that is not dissolved can go from your leg to your lung and kill you, right? So that's why it's imperative that when you are using or before you want to use CBD, that you speak with your doctor. You want to make sure that you get a diagnosis, you get appropriate treatment. I don't want anyone on the line to stop taking their medication. You know, you've got to consult with your physician. So if you have a blood clot in your leg, you need to get that taken care of, either with a blood thinner, Coumadin, warfarin, Lovenox. You know, that needs to be resolved. Let's see. Dr. Rita's got to go and get her glasses. I don't see any more questions. Erica Zachary, how are you? I think you were saying something about a water soluble and seasonings. Let me see if I can get Erica Zachary on the other line. Because she may want to say something. I'm not sure what she is writing, but it looks great. Any other questions, comments, testimonies? My daughter has Crohn's and colitis. She is on Stellaria. Okay. So are you asking a question, Anna? Let me know what your question is. Absolutely. You always have to take your blood pressure medicine. You never want to stop taking any of your medicine. Please don't do that. Yes, someone with Crohn's and colitis absolutely can take CBD. Colitis, itis, inflammation, very, very painful. Diet is key with Crohn's and colitis. Incorporating CBD will be very, very, very helpful. There's lots of studies on CBD and Crohn's disease.
Hi, Dr. Rita. This is Erica. I was just adding that those are other things because you were mentioning the tinctures and the gummy at night and during the day that you use. And I do something similar, just trying to keep steady state. So I was just commenting on that because I was sitting here, a meeting late today, but I didn't feel like cooking. So I had sprinkled the seasoning on a sandwich that I had made. I just made a chicken sandwich and sprinkled the seasoning on there and had some salad in my sandwich. And it's a really late and quick meal tonight, and had the water soluble in I have lemon water sitting here. And so I had just put the water soluble in my lemon water tonight. So I was just adding more products. That's what I think about all day. How can I add?
Exactly. I love it. How can you add these products in every area of your life, right? In the kitchen. Yes, we do have products for the face serum. You can check our website for that, Jewel. The flat belly coffee works phenomenally. It helps to reduce your cravings. It helps to reduce your appetite. It makes you feel full. It gives you energy. It has CBD in it. CBD has been shown to transfer white fat to brown fat. Brown fat is the fat that helps to burn calories. It's a thermogenic. It's an amazing coffee. So if you're looking to maintain your weight, reduce your weight, to address that belly that is a liability for your heart, You know, when you have truncal obesity, that means most of your fat is in your belly. You absolutely want to use our coffee. How does statins affect the heart? Does CoQ10 help with minimize adverse tissues? Oh, that sounds, Calvin, that sounds like a question for Dr. Crawford, our family practitioner. But if you have a CBD question, you can ask that one, Calvin. Dr. Crawford,
So,
you want to address
yes, hi, this is Dr. Crawford. The latest research, I would have to check. It was not really evidence-based with the coenzyme. And I'm sorry I missed some of the rest of the question because I'm not looking at the chat right now.
How does statins affect the heart, and does CoQ10 help minimize adverse tissue?
Okay, so the
Adverse
statins,
issues, adverse issues.
right, the statins help decrease the cholesterol plaques in your blood vessel, and if you have decreased plaques, and therefore you increase the blood flow because you don't have that blockage, and then you can have the blood flow go to your heart, which is the one that's pumping the blood to the body. So that's the non-medical version of how statins help the heart out.
Calvin, hopefully that answers your question, and prayerfully you have either a cardiologist or a family practitioner or an internist you're working with, because you definitely want to make sure that your questions are answered by your physician. We try not to be your physician or give a lot of recommendations if you're on medications. We really want you to talk to your physician. This is a great way to engage your physician with CBD, you know, by having a conversation about things that you've learned every single Wednesday about CBD and taking it back to your physicians. That's how you get them engaged in your care, and that's how you get them engaged with learning more about CBD. Wonderful. So if there's no other questions, if you're a guest on the line, we want you to contact the person who invited you so that you can get that wellness pack. You can get those love is in the air just in time for Valentine's Day. You can get all of these products on the website from the person who invited you. So contact them so you can get those products ordered tonight. And we will see you back here next week, next Wednesday, 8 o'clock. Please email me, ritamd@wakana.com. Let me know what you want to hear so we can have amazing discussions each and every Wednesday night. Be well, be safe, and we will see you next week. Thank you, Dr. Tyus Crawford, for joining. Thank you, Dr. Rashonda Conti. Thank you, Erica Zachary. These are all members of our Wakana Medical Advisory Board. They are amazing. Love you all and have a good night.